All right, folks, over the next three lectures, we're going to discuss some adjunct Cox procedures. You'll use these less frequently, but when the need arises, you'll be glad that you know them. Today, we're going to discuss Protocol 1 variation. All right, Protocol 1 variation, a very useful procedure for uber acute patients who cannot lie prone. This is a real crowd pleaser when I teach each year at the annual Life University Continuing Education event. The doctors are all appreciative to learn this procedure. Let's get into some detail. So when do we use it? We use it, number one, if pain prevents a patient from lying in the prone position. And when you get into practice, you'll see that this does happen. You ask the patient to lie on their tummy. They circle the table. They try from the left. They try from the right. They try whatever angle they can. And they say, Doc, I can't lay flat on my tummy. And of course, that is because when you lay prone, it does throw the lumbar spine into an element of extension. And with a really bad disc, they just cannot tolerate that. All right, number two is the patient can lay prone, but they fail the tolerance test. So in other words, you cannot find a treatment start point for that patient. And then number three is the latter stages of pregnancy when you have a large abdomen with a little baby in it. And of course, the mommy's not going to want to lay prone on it. So you would do this on the side. All right, you ask the patient which side they can lay on more comfortably. A good way to discern that would be to ask them in bed at night or in bed last night, which side were you able to lay on more comfortably? Oh, it was the left side, Doc. Okay, so let's lay on your left side. Show them how to do it by starting in a seated posture by sitting on the caudal section of the table and slowly lowering themselves on their side and pulling their knees up on the table. Very important in terms of patient positioning. The patient's whole pelvis must be on the caudal section, not any of it on the thoracolumbar section. That puts the lumbosacral area right in the split of the table, and that's where you want the flexion to occur. So whole pelvis on the caudal section only. Let's erase some of this stuff there and there. All right. So with the patient in the side posture position, have them flex both of their knees toward their chest and then stabilize the feet with the tiller bar, like you see right over there. And that's just to keep the feet from being pulled off the table as the doctor pulls the patient into flexion. You release the lateral flexion lock only. So there's no need to ask the patient their weight in order to determine the correct spring tension for the table. The lateral flexion lock is not loaded. There's no tension, so you can release it with great safety, and that will allow the caudal section to sway back and forth. Okay, the doctor's contact hands. Let's take a look at this lower picture right here. So let's say we have an L4 disc lesion. So we know that the two spinuses that surround the L4 disc would be the L4 spinous superiorly and the L5 spinous inferiorly. Okay, so the doctor's superior contact hand right here contacts the inferior aspect of the L4 spinous, and the doctor's inferior contact hand right there contacts the superior aspect of the L5 spinous. You then begin to pull, and as you're pulling those two spinous processes apart with your elbow, right, with this right here, and maybe it'll be better visualized here, you begin to pull the patient toward you, bringing their lumbar spine into flexion. And you can do that to a degree appropriate for the patient. So to reiterate, this hand is pulling that way, that hand is pulling that way, as this elbow pulls the patient into flexion. And that is going to reproduce protocol 1 with the patient on their side. You would continue this procedure until the patient can lie prone, and then you can continue onward with the standard protocol 1. How long will that take? Hard to say. I'd say 3, 5, 7 visits, somewhere in that range. Just ask the patient on a daily basis, do you think you can lay on your tummy today? I don't know, doc, let me give it a try. And lo and behold, they can. And so you can actually drop this procedure and pick up standard protocol 1. You will find this to be a very useful procedure in your practice, particularly when the really, really hot backs come in and you just don't know what else to do. This is kind of an emergency lifesaver for both you and the patient, and there'll be a much better description of it in real time when you watch the video on it. Okay, that's it for that.